Difference between anorexia nervosa and bulimia nervosa. We knew that both are eating disorders, but here there are some difference for both bulimia nervosa and anorexia nervosa. We can see that the first thing, anorexia nervosa mainly refers to starving on purpose to create a skeletal-like body. So, anorexia nervosa, there is no appetite. Instead of that, what they are doing is they are starved. They will not take food. And they need a skeletal body. So, that's why it is anorexia nervosa. Here, the person prefers starving. But in case of bulimia nervosa, the person refers to binge eating followed by purging, resulting in an average or overweight body due to the residual amount of calorie. So in bulimia nervosa, definitely the person take food and it is a binge eating. Excessively the person will take food and it will be expelled by using laxatives or self-induced vomiting. So that is happening in bulimia nervosa. There will be binge eating followed by purging. So they will cleanse the whatever they had. Okay. Next point, patients are very thin or emaciated most of the time in case of anorexia nervosa. Mostly the person will starve. Okay, so they will not take adequate food. That's why the person always will be in thin. But in case of bulimia nervosa, the person usually have an average weight ideal for their height and age. In or some cases there may be chance for obese body. So usually in bulimia nervosa, the person is taking food, that is binge eating. So that's why there may be chance for adequate weight. Next point is patient prefers to starve or eat less. Anorexia nervosa here, usually whatever we are going to give to this patient, always the person will say no to the food. That's why we are saying they prefer starve or eat less, and they follow the rituals, okay, vrata, like that, in order to reduce the food intake. In case of bulimia nervosa, patient eat heavy meals followed by purging. So in bulimia nervosa, the same thing what we have said. Here the person is binge eat and then it will be cleaned by purging or the use of laxatives. Next important point is, due to this problem or due to the anorexia nervosa, the person may result in complications like amenorrhea, osteoporosis, infertility. Okay, because the person is not able to have food or the person is not interested to have food. So what happens? Usually the malnutrition problems will be appear and hormonal imbalance will occur. So all this that cause amenorrhea, osteoporosis, infertility, etc. In case of bulimia nervosa, here the person may have heart failure, damage to esophagus and teeth. Here there will be the person will have self-induced vomiting and overtension and excessive, the person may have excessive emotional. Okay, so that's why there is increased binge eating and it will be uh, clean or cleansed by laxatives or the self-induced vomiting. So this person is as a complication they may chance to get heart failure or the damage to the esophagus. So that's a difference between anorexia nervosa and bulimia nervosa. And most of the time the anorexia nervosa and bulimia nervosa need treatment. Some may commit suicide for they may have depressive episode. So that's why there is a need of treatment like counseling, need of educational, nutritional education is needed, and uh, hospitalization is needed in case of extreme malnutrition. All these are should be considered when we are treating with anorexia nervosa and bulimia nervosa. Thank you.